What happens to vulnerable populations when an opioid epidemic meets a global pandemic?
And that pressing question is exactly what researchers at Penn State University are studying.
Our Peyton Kennedy joins us live now with what they've learned so far and how access to addiction counseling has been impacted as well. So, Peyton, what trends are they noticing?
Good evening, Matt and Maggie. I'm told opioid overdoses were on a decline in 2019, but now they're losing ground on that progress and seeing significant increases in Pennsylvania in 2020 and on.
While the CDC highlights fatal overdoses, this team of researchers is looking at both fatal and non-fatal overdoses to capture how encompassing the epidemic is. They've been interviewing public health providers in PA.
They've been saying to us for over a year now how concerned they are.
In those conversations, they've learned there are a higher number of relapses as well. This all may come from the side effects of a pandemic.
What's revealing is that the mental health pressures, economic pressures, disruption to traditional treatment services like in-person counseling, if you're undergoing treatment, has been very disruptive.
In their findings so far, the most impacted groups have been white and black populations between 30 and 40 years old.
We don't have a good sense yet now if the pandemic has expanded the reach of the U.S. opioid epidemic or has just intensified it.
Increased telehealth due to the pandemic gave some people access to counseling they didn't have before.
Prior to the pandemic, there were more restrictions on provisions of certain kinds of drugs, how you would see an addiction treatment counselor, and then due to the pandemic, they had to relax that.
For others, the technology involved in receiving telehealth treatments were a barrier.
Brian King also says at this point it's unclear whether that same access to telehealth will remain in place once the pandemic is over. Reporting in State College, Peyton Kennedy, WTAJ News.